You can hear me?
I can hear you.
All right. For those on the call, if you can hear me, I need you to drop a 1. If you can't, drop a 2.
Hey, Nicole. She said, hey. Okay, cool. People can hear. Thank you. Thank you.
Great. Okay.
All right.
So hi.
Hey.
Thank you for joining us. Today's webinar is on birth and self-advocacy during COVID-19 and how to rock your birth even when your plans have to change as a result of this pandemic.
So I am Camira. Hey, you guys. Some of you may know me as Alitra. Hey to y'all too. And I am a co-founder of Our Mother's Light Holistic Birth Services. I'm a birth and postpartum doula, childbirth educator, apprentice healer into the Tem and Gormanche traditions of West Africa, as well as a prenatal and postnatal dance instructor, mom, wife, sister, so forth. So, hey.
And I'm Zetanefir Zipiutu, birth and postpartum doula, 11-year childbirth educator for a long time too, apprentice healer, as well in the Gormanche and Tem traditions of West Africa, belly biting specialist, mother, wife, etc. And we just want to say again, thank you for joining us. And for those of you who joined us early on, thank you so much for being patient and allowing us to troubleshoot with you here.
Yes.
And so who are we
Excuse me.
together? So together we make up Our Mother's Light Holistic Birth Services. And we're dedicated to impacting, but also changing the birth narrative for Black women, their families, and other women alike in and around Chicago and the world. Our model of care is based on our African ancestral cultures, birth and mothering traditions, and it's fused with our various birth trainings and personal experiences.
So if at any point during this webinar you guys can't hear us, or you have questions or you have comments, please use the chat feature and let that be known, because we want to make sure to engage with you guys. I somehow just lost my capacity to see the chat, so Zeta, I'm going to rely on you for that. I might try and pull it up on my phone as well. I'm sorry. But so today we have quite a few topics to cover, okay? We're going to be bringing you guys some really great information. We're going to cover, what does self-advocacy mean? Questions that you can ask your provider, especially during this time. Reconsidering your place of birth, in case that's something that you're curious about, how that works. How to actually talk to your provider. So sometimes you might have the questions, but the actually having that conversation may need some work. So how to actually facilitate a conversation with your provider, trusting your intelligence, advocating for your newborn, both prenatally and once they're born, how to feel safe, and then finding the right support team.
So for any expectant, we need you all to drop a 1 if you're an expectant person or if you're a support person. We just want to get a good gauge of who we have here on the call.
A 1 if you're a support, a 2 if you're, 1 if you're expectant, 2 if you're a support. And you're going to have to change the screen because I can't do that.
Okay. Oh, it looks like we have a good balance here. A lot of support people and a lot of expectant people. So that's really good.
Okay, nice. Very cool.
See your question, Keita. I'm gonna keep that in mind, okay? So let's go ahead and just jump right in. So what is self-advocacy? And I have a quote here that I like from Laila Akita. Know what you want and reach out eagerly for it. So self-advocacy, simply put, is the ability to speak up for yourself and express clearly and effectively what your needs and wishes are. Simply put. So most often self-advocacy happens in cases where people are not being heard, they're not being seen, and it happens a lot amongst marginalized groups. You hear a lot of self-advocacy talk or advocacy talk surrounding civil rights, surrounding birth rights, surrounding reproductive rights, and all of these efforts are dealing with marginalized groups. And in the instance of pregnancy and birth, on a regular occasion, Black women are not being listened to in the birth environment, or even sometimes during prenatals. They're being brushed off. They're being told not to worry. It's okay. We're always made to feel like we're exaggerating, or we're made to feel like what we need, or what we're saying, or what we're feeling isn't valid. And if in a normal environment or under normal circumstances, if this is happening, what do we think is happening while we're dealing with a pandemic and Black women and women of color are showing up to hospitals to birth this kind of a situation where everyone is panicking and kind of trying to get a hold of exactly what is going on? So we wanted to open by talking about the keys to self-advocacy. The first key to self-advocacy is knowledge of your rights as a birthing person in your state. And this is important because me and Kim are hearing it anyway. So whatever rights we have here in the state of Illinois is going to vary for someone who's in Minnesota or North Dakota or Florida, New York, Texas, etc. Every state's law is different. So you're going to want to educate yourself on what your rights are as a birthing person in your state. The second thing you're going to want to do is you're going to want to learn what the hospital's protocols and policies are for birthing persons. And this is what the policies and the protocols are and procedures are under normal circumstances. You want to know what they are under normal circumstances. And then you want to check in with your provider to find out what the new protocols and procedures are under COVID-19, or while we grapple with COVID-19. And then the third key to achieving self-advocacy is remember to ask questions. So during your prenatals, and even when you arrive to the hospital in labor or during postpartum, always ask questions. Never take what the doctor says at face value or your provider says at face value and leave it at that. Remember, because you've already educated yourself on your rights as a birthing person, and you're already aware of what the normal hospital protocols and procedures are and what they are under COVID-19. You also want to remember to respond to questions. So when a doctor asks a question, make sure you ask a question to you, make sure you respond. And then you also want to summarize what is being said to you. Meaning, when your doctor or your provider says something to you, or nurse says something to you regarding a request or a wish or anything, you make sure that you summarize back to them what they said. If you feel like you need to repeat what they said to you verbatim, repeat what they said to you verbatim. You want them to be clear that you understand and you comprehend clearly what they're saying to you. And then the last thing is to make sure you name your goals. Be clear, be direct, be straightforward in what your aim and your goals are for your pregnancy, for your birthing time, and for your postpartum recovery.
Can you unmute me? Okay, there we go. Girl, I'm sorry, guys. I'm dropping off and everything. So again, but we're going to roll with it. So now we're going to get into some questions you can ask your provider. Okay, so the questions are going to fall into 4 categories. The first being policies and protocols of the hospital, the birthing center, and even if you're having a home birth, this can apply there as well. Then there's questions for labor and birth, postpartum and newborn care, and then client support. So let's get started. Okay, so this is a list of questions that you can take to your provider to find out detailed information about how things are operating, again, in light of COVID-19. So you want to ask them, have any general limitations for birthing people been imposed as a result of COVID-19? Again, things may have been different, or they were different before. It's not may. I mean, I think changes are made across the board. So maybe what you were expecting before, or what your options were before, may now be somewhat limited. So you want to ask them that question. Also, what are the screening protocols for nurses and doctors that will be working with moms and babies? So while facilities are taking care to reduce the number of support persons that mom can have in efforts to reduce the potential transmission of the virus, we still need to know what they're doing for their own staff and for themselves in order to reduce the risk of transmission as well. So how do you ensure that those that are caring for me and my newborn at this time are not going to put me at risk for catching COVID-19? Are you screening birthing persons and their partners? If so, how do you determine that? Are you screening everyone? Are you screening those that show some symptoms? If you're not screening anyone, then how do you determine, or how do you sort of ensure that the risk of transmission is being reduced? So, these are just questions to ask, and all of this can give you information about how to move forward. What protocols do you have in place to protect clients from contracting COVID-19 during their stay? So once I'm there, I'm fine, I didn't come in with the virus. Now, do I have access to masks? Do I have access to gloves? What is in place for me and my partner and my baby so that we don't bring home something that we did not come with? Also, this question is really, really big. I think it's actually the most important question on this slide. How would you describe the goals of the care team at this time? What's most important, allowing birth to unfold or controlling it? And the reason this is so critical is because sometimes providers can see birth as something that needs to be controlled and managed, right? And even now, even more so now, especially as the virus is here, there may be efforts put in place to kind of speed things along or keep things on a regimen, something that's within their control, which could mean introduction of unnecessary interventions, which also have their own consequence and pathway that they follow. And so knowing what's most important, are you guys, are we still treating birth as a natural phenomenon that's okay? Or are you guys trying to control it? And then that'll really give you some insight as to how to move forward, if you want to continue, some follow-up questions to ask, et cetera. And then lastly, what is the best way to stay up to date with the birthing facilities, protocols and procedures, because they are changing rapidly. What was in place yesterday may not be in place tomorrow. So you really want to make sure that you're up to date. And if you have any questions along the way, drop them in the chat and we'll be checking in just a moment. So the next thing is labor and birth. Given the current circumstances, what does a normal labor shift look like for your staff? Do you have a shortage of nurses currently? Are nurses tending to a smaller number of patients now in order to not interact with so many people? Do you still have residents coming in and out? What does that look like for your staff at this time? And then also the same question, given the current circumstances, what does a normal labor scenario look like for the birthing person? So for me, what does that look like? Am I confined to my room? Do I have access to the kitchen, the snack room? Can I order food? Like what is that going to look like? How am I being impacted now so that I can plan and be as prepared as I can? The next one, if I test positive for COVID-19, how will birthing options be impacted? So this is a really big one, and we'll talk more about this later as well, but you really do want to know how your birthing options are going to change if you test positive, or even if you're suspected of having COVID-19. What does that now look like for you? What are the dynamics? Also, what is your current position on birth plans or birth goals, right? So oftentimes, birthing people will come in with some type of vision or some type of priority for their birth, things that they want to achieve and accomplish. And is this something that your care team is still willing to accommodate as much as possible? Or again, are we kind of going back to that other question of, or are you in a position where it's more so about controlling birth instead of allowing that leeway? What will my care look like for a cesarean birth? Okay, right. Some birthing people know that they have a scheduled cesarean, and so what does that look like? Can I have a support person back there with me? What does it look like after the baby is born? Just in light of everything going on, have your policies and protocols changed for this scenario? And then lastly, do I have access to the full amenities and care team? So that means anesthesiologists, you have your OB or your midwife, your nurses, your lactation consultant, your pediatrician, your NICU team. Are all of these resources still available to me? Not only that, if there are options for birthing in a tub, is that still available to me? Or are there some limitations in place at this time? Okay, and y'all, I hope you're jotting this down or screenshotting or something, because I know I'm going kind of fast. We do have a lot to get through. But again, drop any questions that you have. So postpartum and newborn care. Go ahead.
And quickly, we will be able to share the recording with you after the end of the webinar. And when you watch the playback, it does share the screen with you. So you will be able to rewatch it again. And if there was some questions in here that captured your attention, you'd be able to jot those down as well. Also, we did have a question come in from someone who's named iPhone. And so iPhone asks, do you recommend calling the hospital directly to ask these questions?
I would recommend, I'm going to say it's going to depend. Right now, some prenatal visits have been postponed or spaced out in order to limit how often someone is going to their birthing facility. And so if your prenatal visit is, some time away, I do think it could be useful to call. If there's a way to either contact your provider directly or even like the charge nurse on the floor, you definitely want to ask them, because you do have to get specifically to like the maternity section. So if you have a prenatal coming up very soon, then I do think in-person conversations are very valuable. You get to see each other, feel each other, and really get the information. So, but again, it's up to you depending on kind of what the scenario is. Good question. Okay, so going into postpartum and newborn care. Same question, what will my postpartum stay look like? Is there anything unusual, anything different about it? Are you opting to send mothers home sooner? If so, what is that time frame for a vaginal birth? And what is that time frame for a cesarean birth? You can also ask, if I desire to be discharged sooner, how do I go about doing that? Because you may want to, take that yourself. And again, depending on the hospital and the timing of when they do the newborn procedures and all of that, you may get different answers, but it's still a question that you can ask. And if it's something you really want, then you can advocate for that. Also,
I think we may have
what will monitoring
lost. There we go. There we go. You're back.
You got me?
We got you back.
Okay,
welcome
guys.
back.
Thank you. Okay, so with the monitoring once you're home, just what do they have in place to make sure that you're going to receive the care that you need should some type of emergency arise, especially with you going home sooner? Also, have there been any changes to newborn procedures in light of COVID-19? And we'll really get into newborn procedures later, okay? But that's just a question to ask. Next question is a really important one as well. Do you support the evidence behind the benefits of skin-to-skin and newborn and skin-to-skin and breastfeeding to build a newborn's immune defenses? And you will learn later, why this question is so critical, but it's really, really important, and it's good for you to know kind of where your provider stands with this. And then lastly, what are your NICU policies during COVID-19? We already know that babies that have to go to NICU are a more vulnerable population. And so are there extra measures in place right now? Can I go back there with my baby? Just what does that look like? Okay, and the last part of this is client support. So this is the big question that a lot of women and moms have been wondering: will my partner be allowed during my birth? You may have heard that in some places, birthing people were restricted from having any type of support. And I don't know about you, but that is a really, really big deal. And that can have huge implications right now and in the long run. And so, you really want to find out, will my partner be allowed? And is it
I think we lost her again, guys. Can you all hear her? If you can hear her, drop me a 1. If you can't, drop me a 2. Okay, I'm just gonna give her a second to try and get back. And if not, we're gonna keep moving forward. Okay, she's back.
okay? Sorry, guys. I'm dropping off, but thanks for bearing with me. So your partner is normally that extra set of eyes. So who's going to be that extra set of eyes in the event that you're alone? What does that look like? And then also, in the event of an emergency and I have to birth by myself, who is communicating with my family, with my partner, to let them know that something is happening? And when does that happen? Okay, that is a very important question, because things do arise during childbirth. And we need to know who's communicating with your support team that could not be there physically, okay? Do you have a patient advocate department? The patient advocate department can help you understand your rights, help you with any complaints or grievances that you have, et cetera. And so it's good to find out if your hospital has that, and then even get the contact information. How do I reach them? And maybe even introduce yourself if you feel like that's something you need to do. Also, what is your current policy surrounding doulas? So another thing, many hospitals with them having limited the number of visitors that a client or birthing person can have, that means for the most part, it's been one person, or in some cases, none. There are some exceptions in other places, but generally people are being forced to choose between their partner being present or their doula being present physically. And so you want to find out, what is your policy surrounding doulas? Are they still welcome here? Who makes those decisions? Is it a case-by-case basis? Is it only certain agencies that certify these doulas that have privileges? What does that mean? And then also let them know, or just have the conversation. I'm planning to have virtual support. Even if I have partner support, I still may have virtual support. How do you feel about that? Are there any specific considerations that need to be had in order to facilitate this? Because you don't have to give up your support altogether. Whether or not someone can be there, which is ideal, I get it, it's ideal. Even if someone can't be there, having virtual support, someone that's consistent, that can really be beneficial. And so It can be your partner on Skype or Zoom or FaceTime or whatever. It can be your doula there. You know, that's something that that you can have. So let us know in the chat. Drop a 1 if you have already assembled your birth team, your birth support team, and a 2 if you are still assembling your birth support team. Okay.
And while we wait for
Yes.
those responses to come in,
They're on it.
Anna Carvelin had a question. She wanted to know if you could repeat about partners, since right now that's a really big topic.
Yes. So I was saying to talk to your care provider, OB, midwife, whoever that person is, what the policy is surrounding partners. And again, things are fluid right now. So what answer you get today may not be the case tomorrow. But ask them, will my partner be allowed to attend birth? And this is in the event of a vaginal delivery, as well as even if you know that you're having a cesarean, will my partner be able to attend? In the event of an emergency cesarean, can my partner come back with me? And is there any discussion that might change? Do you have any foresight about that? And if they're not able to be there, who's communicating with them on my behalf should something happen? And when does that happen? Do you do it after? Is someone assigned to communicate with them while it's happening? What does that look like? Because it's very important that my partner knows what's going on with me. Oh, you're muted.
So reconsidering your birthing place, we just have a quick note here we'd like to share. We want it to be clear. We are not trying to induce fear. We are not here to induce fear or panic. We simply want you all to know what other possible options you may have. We're well aware of the current birthing climate where, you know, people are kind of scrambling, trying to figure out what they're going to do, thinking that home birth is the best option, you know, thinking about unassisted births. You know, people are just trying to do what they think is best currently while we deal with this pandemic. So we don't want to induce any more fear or give any more anxiety or any more panic, because we understand already how difficult things are under this current climate. But we did want to talk to you all about just giving some thought to possibly changing where you're going to give birth. So under reconsidering your birthing options, we're going to talk about why consider switching the place where you're giving birth, what are your other options, and then steps to secure an out of hospital birth. We also want you to understand that if you're planning to change where you're going to give birth, now is the time to do it. Keep in mind, there are many pregnant women, and there are many people trying to figure out what they're going to do, if they're going to birth in the hospital or if they're going to figure out how to birth somewhere else out of hospital. So we don't want you all to wait. We don't want you to panic, but we also don't want you to wait. Because we want you to have the birth that you desire, because we truly believe that even under this current situation, that a lot of thought, consideration, and planning, you can achieve that birth. I don't know why it keeps muting me. I'm sorry, guys. Did you all hear when I was on this slide here, reconsidering your birthing place? Drop a 1 if you did, a 2 if you didn't, because I'm more than happy to go back over it. Okay, great. Thank you. Okay, so why consider switching your provider? So birth under normal circumstances is a naturally occurring phenomenon, and it doesn't require hospitalization. So how many times have we heard stories about someone giving birth in a car, or someone going to the bathroom at home before they even leave to go to the hospital and giving birth on the toilet? Like, it happens, so you don't have to be hospitalized in order for birth to occur. And if a mother is healthy and she's having a low risk birth and there's no concerns, then a hospital birth, out of hospital birth, is a possible option. And it's going to give you control over whether or not your baby is exposed to this virus, because right now this is a new virus and nobody really knows really how it's even transmitted, or really what the implications are for pregnant women and for their babies, whether that baby is in utero or out. They don't really know yet whether or not the mother can transmit COVID-19 in utero, and they don't really know how it transmits from mother to baby, even once the baby is born. So to make sure that you can maintain control over whether or not you and your baby come in contact with this virus, perhaps considering an out-of-hospital birth is a good option. So what are some of your options? One option would be the freestanding birth center. And a freestanding birth center is kind of like what it says. It's just it's a medical facility or a clinic where you will go and you will meet with your midwives prenatally, and then the same place where you're going to do your prenatals, you'll also go to that same place to give birth. There's a separate section, of course, where birth happens opposed to where prenatals happen. But it is, and the midwives typically have privileges to a hospital. So if anything was to go awry, they'd be able to transport to the hospital, so on and so forth. And it's a safe option. So if you are considering having a birth at a birthing center, there's just a few things that you may want to consider. One would be, are there any in your area? So it's going to vary from state to state. For example, here in the Chicagoland area, we just got our first freestanding birth center just a couple years ago. It was like all the rave, like everybody couldn't wait for this freestanding birth center to open. But if you're in an area like California or even Texas, you may have more access to freestanding birth centers. And you want to figure out if there are any in your area first, before you decide whether or not you're going to birth in the hospital or out of the hospital, because you really need to be clear on what your options are. So once you've taken the first step, the second step would be to figure out or find out whether or not they're taking any new patients. Again, like we talked about in the first slide of this section of reconsidering your birthing options, right now, a lot of people are trying to figure out where they are going to give birth. And from what I hear, midwives are really being swamped right now with calls from new patients or people who want to become patients of their practice. So if you are considering the birthing center as an option, jump on it right away. Then the third thing you want to figure out is, do they take your insurance? The one thing we don't want to see happen is you guys find out that there's a freestanding birth center in your area, they're taking new patients, and then you quit your old provider before you find out whether or not they take your insurance. So we want you to make sure that they take your insurance before you switch providers. And then the fourth thing is, what policies and procedures do they currently have in place regarding COVID-19? Because you don't want to switch from a hospital birth with the goal of protecting yourself and your baby from coming into contact with the virus, and then the birth center doesn't have any policies or protocols in place to prevent transmission. So we would just want you all to make sure you cover all your bases regarding switching providers. And then the second option you have, of course, is to birth at home. There are a lot of people who are exploring this idea, whether they are considering birthing with support or they're considering birthing unassisted. Again, we are advocates of people choosing what it is that they think is best for their families. So if that is an assisted birth or an unassisted birth, that is totally up to you. We are not here to place any judgment on you for that. So the first thing you want to do, just like when we were talking about with the freestanding birth center, is to find out if there are any home birth midwives in your area. So there's a few type of home birth midwives. There's the LM, which is the licensed midwife. There's the CPM, which is the certified professional midwife. And then there's the CNM, which is the certified nurse midwife. Here in the state of Illinois, LMs and CPMs are not allowed to legally practice in the state of Illinois. There's current legislature really trying to push for this to change. And we really do hope that it changes, because it really opens up options, especially for women of color who are dealing with implicit bias in the birthing environment. So perhaps in your state, you have more options, but currently in the state of Illinois, the only ones who can technically deliver a baby in a home birth is a certified nurse midwife. And those are the practices here. There's only a handful of midwives here who actually are CNMs and are a handful of practices, not a handful of home birth midwives, a handful of practices that currently offer home births through their practice. And then the second thing to consider is, again, are they taking new patients? The third is, do they take your insurance? And then lastly, what policies and procedures do they currently have in place regarding COVID-19? I want to really stress, with switching providers, sometimes getting the birth that you desire is really about having built a relationship with your provider. Relationships are really important. And so if you're planning to switch, you may lose out on the opportunity of having built rapport and a relationship with your provider, but still that should not hold you back, because hopefully if you have started already assembling your birthing team or your support team, you have other people on your support team who you have a clear and defined relationship with, who you know will support you during your birthing, your labor, and your delivery, and even your postpartum recovery. So for those of you who are joining us live, I just want to know if any of you have already switched providers. And if you have switched providers, what are some of the challenges you've experienced in having switched as a result of COVID-19? And if you haven't, no worries. I'll look at the chat for a quick second, and then if I don't see anything, I'll just keep moving. Okay, Thelma says, not yet. I am due in July and have not formalized my birth plans yet. Okay, yeah, you have some time to go. So yeah, you're in a really good spot to actually switch providers, because hopefully by the time July rolls around, this thing will kind of be calming down, or would have calmed down. And so, providers will probably have quite a few, uh, quite a bit of room to accept new patients who are delivering more so towards mid to late summer and later in the year. Selena says, feel the same way as Thelma. She's due at the end of July. Aw, look at these moments. Oh my goodness. It brings me so much joy. The anticipation of a new life, and just how this earth makes space for each and every one of us. It's such a profound experience, and it's a really the experience really touches my heart. Okay, well, we're gonna keep moving.
All right, so next we're going to get into how to talk to your provider. So there's a quote from Maya Angelou: hope for the best, be prepared for the worst, and unsurprised by anything in between. I think that is so powerful. It may be a little difficult to do in practice, how you want to have the full spectrum of options and considerations covered going into your care. Okay, so we're gonna, at the top you'll see I'm speaking about prenatally. So in your prenatal appointments, some ways to talk to your provider, and then at the bottom is during your birthing time, okay? So the first thing is you wanna choose your team wisely, and you can see that this is kind of a theme, right? You want to research your hospital or your birth center or your midwife, your OB, whomever it is, in advance. Some things that I think are good or valuable to look for are, reviews. What are the C-section rates? Is it above average? Is it average? And even the average is kind of high. And that just can give you some information about, kind of philosophy and even meeting them. I know I met with a few providers before I decided, who I would go with. So research, do your due diligence, and choose your team wisely. Find a supportive provider early, and if necessary, switch. Okay, you're never stuck. Never might not be the right word, but you do have options. Even late transfers are sometimes accepted if necessary. But it's best to, try and avoid that situation if possible. Also, during your birthing time, you can request a nurse that enjoys serving families who are seeking a natural birth, should that be what you're deciding or what you're going for. Now, I get it, I understand at this time with the pandemic that option may not be available, but it doesn't hurt to ask. And then also, if the nurse that you are assigned isn't working out very well, you can fire your nurse and request another one, because having the wrong person in your birthing space can really, really have some negative consequences as to your labor. It can slow things down, create tensions. I mean, you name it. And so it's really important to have like the right people in your space. And so if a nurse is not working out, then just request another one, and you can really be adamant about that. Next is, I hope I'm still here. Okay, next is assume you're on the same team. So even though we're pointing out the facts, which are marginalized groups are receiving less care during their birthing time, that there is implicit bias. Those are that information, and still seek to that we're on the same team here, we're on the same page. And as you build your relationship, that can further, strengthen that feeling. You want to go in expecting good treatment, right? And then it's also, if you've done your research before and you've chosen a facility or a provider that you think can provide what you need, then you're more likely to have that good treatment that you need. On the bottom side, keep an open mind and a clean heart as well. At the same time, if you have reason to believe, or that you may be facing some conflict or some challenges with your provider. Keep that in mind. And we're not saying go in naively, because now you have the information. And if you haven't switched, like, you just take that in with you and you assess the dynamics. What are the dynamics between me and my provider right now? What are the dynamics between the nurse and the provider? Between my partner and the provider and the nurse? So you just really want to assess the dynamics of the situation, and that'll give you information that you need in order to move forward. The next thing is you want to come prepared and be grounded. So one of the things that is really important is knowing yourself well, right? So knowing yourself, your body, your sensitivities, your goals, whatever's important to you, you want to know yourself well, so that when you're communicating with your providers and you guys are building a relationship, they too get to know you well, right? And you're bringing all of yourself into the space. I also really encourage you to be proactive in finding answers to your questions and concerns. So this right now is really not the time to be passive. If there was ever a time to not be passive, this is probably a good time for that. So really be proactive in finding out whatever you need to know, even about, you know, how your body works, childbirth education, whatever, all the things, so that you can equip yourself in the event of anything happening, whether you're there alone, whether with your partner, whatever. You just want to really be equipped. Also, when speaking with your provider, prioritize your concerns and be specific, okay? Because you really want to walk away with having those priority concerns and questions answered in the event that they're not able to spend an extensive amount of time with you. On the birthing side, during your birthing time, you really want to mentally prepare yourself. So birth is a very physical experience, but it's also the mental strength that plays into that. Mentally, for the journey that you're about to embark and find, you will do great. You can do it. Like, you are stable, you are fully capable, and like, you got this, okay? So you go in with a winner's mindset. And then also have your birthing goals, your birthing priorities, and be ready to share those with the care team. And again, because you already asked them earlier, how do you guys feel about birth plans and birth goals? You know, you've already prepped yourself for, you know, kind of what to expect here. So, you know, okay, here's my birth plan. You might have an idea as to whether or not they are, like, with open arms willing to try and stick with it, or if there may be some resistance. And then lastly, you want to work collaboratively. So this goes back to the keys to self-advocacy, right? So you can ask questions. When your provider says something, okay, is this evidence-based? Can you show me the evidence behind it? Or where can I read more about it? I'd like to look into it more. Also summarize their talking points, because it lets them know that you're listening, you're hearing them, and you're holding them accountable to what they said. So you're repeating this back. And then after that, you still name your goals. It's a dialogue, it's a relationship, it's an exchange. And so you really want to, you're a partner.
Okay, I think we lost Kimita again. Can you all let me know?
This is a really great time to have your partner help facilitate those conversations and questions. And then also, just for continuity of care, you can ask your provider or your nurse, hey, when the shift changes, can you just let me know? That way, it's like kind of a seamless transition. You get to meet the new person, and, you know, we're really working as a family and as a team to make sure that the changes in staff don't really cause an interruption to your own labor in progress. Okay, another big thing, and this goes back to the beginning as well, is knowing your rights, informed consent. So Basically, this is saying that you have the right to be given information about every suggested procedure, its alternatives, its benefits, its risks, everything, the full spectrum. And you have the right to ask clarifying questions in order to get the information that you need to make the decision that is best for you and your family. And you deserve to have that communicated to you in a way that you understand. And so if there's language that's being used that you can't quite understand, you can ask them, okay, I need you to repeat that to me. Or even in you repeating it back to them, that may expose some areas that you didn't understand and allow for further clarification. Now, during your birthing time, often what happens is providers and nurses and the staff, they kind of just default to what the standard is. This is just kind of normally how things go. And so if you are not, if you're not, a little more forthright, that may be the case, but you really can express that, look, hey, I'm a fully capable human being and I have the right for information. So instead of saying, this is just what we're going to do, no, you can explain it to me and then we can talk about it and then I can consent to it, right? But during childbirth, oftentimes that's not the standard to walk a birthing person through what's going to happen step by step. It's generally the default, this is what we do. And then, your partner or your doula or whomever can help to facilitate those conversations. The next one is you want to establish your boundaries. And this is something that you want to start with in your prenatals. And again, none of this is from an aggressive perspective. This is simply, I'm a partner in my care. I care most about me. You're going to be the one that cares most about yourself anyway. And so you set the tone for who you are, what your expectations are, and the care that you want to receive. So setting your boundaries prenatally, you can establish, I want you to explain first before anything is done and then await my consent. Again, rather than saying, okay, I'm going to check you now. The question should be, would you like for me to check you, right? Or if you're not sure what that is, then you get the clarification on that as well. When speaking with your provider, you interrupt when interrupted. And again, this is not from a malicious point. Please understand that. We cut each other off when we're talking to friends and stuff, so I'm not saying it to suggest that there's some ill intent behind it, but the reality is when you're interrupted, there's an assumption that they know what you were gonna say, or they have the entirety of what you were gonna say. And that may or may not be the case, but you deserve to finish your part. And so you can say, excuse me, I wasn't finished talking. Hold that thought until I'm done, right? And you can do it very politely, it's no problem. During your birthing time, same thing, explain first and await consent. And as you progress through labor and things sort of intensify, your partner may have to help facilitate that more, okay? You can also let them know any discussions and any decisions will need to wait until my surge is passed. Having contractions is probably not the time to discuss things that you need to make a decision on, because it's really difficult to fully focus on what's being said. So wait for the contractions to pass and then we can discuss this. Or I need to make decisions with my partner. If my partner is not here, then I need to call them. So I need you to wait a minute, or can you come back in 5 minutes? I'll get him on the phone and then we can talk about this together. And then lastly, we want to give you this acronym BRAIN, which stands for benefits. So what are the benefits of what's being suggested? R, what are the risks? A, are there any alternatives? I is, what is your intuition saying? And then N is, well, what if I do nothing? Or I need to decide. And so this can help you get the full scope of information that you need in order to make decisions or ask further questions about your care. I know that was a lot. And then practice and affirm this to yourself, okay? You have to believe it. You have to know, I can do this. I am strong. I am intelligent. I am fully capable. I trust myself. I trust my body, and just practice that and really put that in your mind and your heart. Are there any questions that came up or comments? I know, y'all, this is a lot, but we really wanted to
Yes.
give you everything.
Yes, it is a lot. It is. So if you all have any questions, drop them in the chat and we'll make sure to get to. We did have some more people say that we have someone and they're not sure if they want to change providers just yet. And then we have another woman who is expecting the first week August, and they're a second time mom. So congratulations to you
congratulations
too as well.
Yes.
So let's keep moving. Talk to your provider and asked all your questions and you've accumulated all of the information and the knowledge that you needed. Sometimes to trusting your own intelligence and your own intuition. There's this quote like from Maya Angelou, light which shines within. Intuition plays a very important role in our day-to-day lives and our day-to-day decision making. And it's not even, intuition isn't something that we can even scientifically prove, quantify, qualify. It's just something that we naturally have as human beings. And we all have had those moments where we're like, man, I should have just trusted my gut, or I had this gut feeling that this was gonna happen, or this wasn't good, or I should have did this, or I should have did that, or I should have trusted my gut. And as a doula, I've been a doula for 11 years. I've had experiences with people, with my clients, and one more recently where she had just got checked and she was 7 centimeters. And she was ready to get in the tub, and the tub was ready. And so the midwife told her she can get in the tub. And so she gets in the tub, and then she's been in the tub not even 5 minutes. And she's like, oh, I feel like I have to push. And the midwife was like, oh, you probably don't have to push. We just checked you. It's tough to go from 7 to 10 in 5 minutes, which we all know birth is very unpredictable.
Yeah.
So it's very possible to go from 7 to 10. She proved it. And the midwife was like, oh, just stay in there. You know, under some hospitals that would be fine, but this particular hospital, you can't birth in the tub. So you have to actually get out when it's time to birth. And so she was like, no, I know this baby is coming. I'm just gonna get out the tub. And so she got out the tub against her midwife's advice and her midwife, or and she birthed less than 10 minutes later. So that's a really good example of a mother trusting her intuition, a birthing person's intuition. And it's okay to be led by nature and to choose, what we kind of inherently have as human beings over technomedicine. That is your right. You get to make that decision for yourself and for your family. Because we understand, like, this isn't a culture even or even gives any reason to intuition. They don't even say but we know that it plays a really important role in decision making, and it plays a really important role in mothering. I'm a mother. I have 5 kids. I know how many times I've just had to go with my gut on things, and more often than not, my gut was the right decision. To go with my gut was the right decision. So in the case where you are deciding to trust your intuition or go with your gut feel over what is being pushed on you by a provider or what's being suggested by a provider, that is okay. We want you to think about what we talked about in the beginning, those keys to self-advocacy, because when they're pushing on you or imposing on you something that your gut is telling you not to do, You need to make sure that you call on the tools and the knowledge and the intelligence you have. You know, you got that card in your back pocket now because you've done the research. You know what your state says about your rights. You know what the hospital policies and procedures are. You know, you've asked questions during your prenatal. You've asked questions since you've gotten that birth. You've made sure they understood, they were clear that you understood what they were saying. You know, so you've done everything that you needed to do. So when your gut is telling you to do something, it is okay to trust it. And we want to encourage you to trust that feeling more. And then what does your intelligence say? So intelligence can be defined as the to kind of gather the information and the skills and the tools that you need to do whatever it is that you're trying to do, period. If that is learn how to read, if that's ride a bike, if that is figure out what your birth philosophy is, figure out what type of birth you want. You're going to have to take the necessary steps in order to do that. And that's what is called intelligence. And so during your pregnancy, and you aren't currently a support person, we all know we've done things, gain the knowledge and the skills we need to inform our pregnancies, to inform our clients, to make decisions about what we want our birthing time to look, or to help a client make decisions about what they want their birthing time to look, or even what they want their postpartum recovery period to look like. And asking these questions and taking this information in and then processing this information, you more than likely, if you haven't already, you've considered hiring a doula. You've considered writing a birth plan, or you have written a birth plan. You've attended childbirth education courses. You took the tour of the hospital. You've taken prenatal yoga. You know, you've done all these things you need to do to inform your decision making. And so we don't want that to be taken away from you once you get to the hospital. Now, we do understand that there are doctors and nurses and midwives or other medical professionals, they're doing their best to protect the public from the spread and the transmission of this virus. We get that wholeheartedly. And we are very grateful for all the work that they are doing on the front lines. But we also understand that each and every last one of us are autonomous beings who have the capacity and the capability to make sound decisions for ourselves. And no one and nothing should take away our agency. And so in Chicago, they're currently allowing for one partner or one person to attend the birth with a mother. So people are being told, hey, if you have a doula and your spouse wants to be there, you're going to have to choose between your doula and your spouse. And, you know, what ended up happening for a client is, well, they chose the doula. But then they learned later on that, okay, I chose the doula, but they weren't really clear in what they were expressing to me. So what I learned after the baby came is that I can only have one support person, period, the entire stay. Meaning whoever was at the birth is also the only person who can come back for visits after the baby is born. So chose the doula for the birth, thinking that the partner could possibly come afterwards to meet his newborn, and was told, no, the only person you can have visit with you is the person who was there during your birth. And so that's putting people in a compromising position. So you want to make sure that you're using your intuition and you're using your intelligence and you're remembering all those keys that we gave you to self-advocacy, so that you can advocate for yourself when you arrive. Now, up until this point, we've been talking about advocating for yourself, but now once you get to the hospital, you go through the throes of labor and your baby is born. Now you have to switch your attention to not only advocating to yourself, but now you need to begin to advocate for your newborn, because you are the one that will promote the your baby. And is there anyone? We have a message. She's in Florida, and her provider told her that exactly whoever comes in during labor and delivery is the only person allowed, even in recovery. So yeah, it's the same thing here, you know, in Chicago. So that's something that you guys are, that's one of those questions you're going to want to make sure that you ask. Oh wow, we're getting an emergency alert here that in the state of Illinois that the state needs licensed healthcare workers to sign up at illinoishelps.net to assist the state with fighting COVID. So this is a very serious situation. And so you really want to consider your other options, and really, and if you're deciding that a hospital, if you're still going to stick with a hospital birth, you're going to need to be clear on how to advocate for yourself and for your newborn during this time. I just want to ask you all, those of you quickly who are on the phone, on the webinar with us, I'm sorry. If any of you all have already established a plan, a newborn plan, what policies and protocols are in place once your newborn arrives, and what you want, what you don't want? Has anybody decided on that yet? If you have written up if you have given some thought or even written your birth plan and included your newborn plan, drop me a 1. And if you haven't, drop us a 2. Regardless, it doesn't matter. We're going to help, you through that process too.
Yes. So we have a few twos. Okay. So this next section is perfect.
Yeah, we want you all to tune those ears in really, really well. And again, we are going to share this webinar with you afterwards, so you can go back and read for yourself and jot down your questions and your concerns. And we are available via email to answer any questions or concerns or anything that you have regarding your care or regarding your support once this webinar is over. Remember, you know what's best for your baby. You, the mother, the one who has been carrying this baby for however long you've been pregnant, the one who is bonding with this baby, the one who is sacrificing for this human being inside. You know what's best, and we want you to remember that. If you haven't already, there are some questions you may have asked during your prenatals, and if not, that's okay too. But some of the questions you may have began to ask or have began to think about in order to formulate your newborn plan is like, what are the policies on delayed cord clamping? Because like Kamita mentioned a little while ago, most hospitals or doctors and nurses are going to default to whatever the standard policy and procedures are. So if there are some things in the hospital's policies and procedures regarding newborn procedures, you will want to know what those things are, so you can decide whether or not those are things that you want. And so in a lot of places, even though WHO is saying that delayed cord clamping or ACOG or all these other organizations are saying delayed cord clamping is what's best for baby, because a lot of stem cells and a good deal of the baby's blood is retained in the placenta and in the cord. So if you don't clamp the cord too soon, that baby will get all of that, and that's really good for the baby. A lot of hospitals aren't up to that standard yet, so you're going to want to be clear if the hospital is up to that standard. And you will want to know, do they allow for delayed cord clamping? Or if you're really concerned about bonding with your baby in the first few minutes of birth or the first hours of birth, do you allow for delaying of the newborn testing for the first hour so that I can bond with my baby? What are your policies on this? Can we do skin to skin? Is this a baby friendly hospital? Can we roam in? What are the benefits and risks of newborn vaccinations? Does my baby have to get the erythromycin in their eyes, which is the eye ointment that is standard? They put it in the baby's eyes Once they give it to the nurse, for the nurse to weigh, so on and so forth. And if it's something that you don't want, you want to know, can I decline that? So these are some of the questions. These are normal questions that you ask, whether we're dealing with COVID-19 or not. And under COVID-19, or while we're dealing with this or trying to traverse this pandemic, these are questions that are still very valid, because all these things are tied to the long term for your baby, not just the here and now, but the long term. You want your baby to receive all its blood from its placenta and its cord, because your baby's life is going to extend past the first days, minutes, hours. It's going to extend past this pandemic. So you want to give your baby the best chance at this life. And so we want to make sure that you're still asking these questions, even while we kind of grapple with COVID-19. So why is advocating for your newborn COVID-19 even important? Well, under regular circumstances, advocating for our newborn is important. This is our baby. These are your babies, the ones that you're going to raise and rear and nurture and nourish and love. And, as you grow older, they're going to return that same thing to you, so it's important to advocate for them every step of the way through their life. But it's extremely important to advocate for them when they are not in the position to advocate for themselves. And again, like I mentioned just a few minutes ago, most hospitals are going to default to whatever their standard policies and procedures are. So if that is not something that you are comfortable with, you need to make sure that they know that that's something. You just need to make sure that you've made it clear during your prenatals, and even remind them once you arrive to the hospital what your wishes are. And we do understand that at a certain point in birth that you can't really, especially right after the baby comes, you may not be capable of keeping your eye on everything and everybody in the room, because everything is moving so fast at that point. You can also have the person, your support person who's there, making sure that they keep an eye on the baby. So you also will need to have had a conversation with them about what your wishes are. If you don't want erythromycin and they go see and the nurse start to put erythromycin in the eyes, your support person can say, hey, excuse me, she doesn't want that. And if your support person doesn't feel comfortable talking to your medical care team, they can come to you and say, hey, I noticed the nurse has that eye stuff you were telling me about out. Do you want them to do that? And you can say, no, I don't want that. And you can, in that moment, say, hey, I see you're getting ready to put that stuff in my baby eyes. Don't do that. I don't want that, because again, they're only going to do what is the default, and that is to just meet the standard hospital policies and protocols. And also, it's important to advocate for your newborn under this pandemic, because the CDC is recommending that newborns be separated from their mothers after birth if the mother is showing signs or symptoms of having coronavirus, or what we also know as COVID-19. So if you're sneezing, if you're coughing, if you're having a hard time breathing, so on and so forth, and they think that you could possibly be a carrier of COVID-19, they're going to suggest that they remove the baby from you or separate you from the baby after birth. If you've tested positive, they're more than likely going to separate you from your newborn. And they're saying this because they're saying, well, we need to prevent transmission, because because it's a new disease, they don't really know how transmission really happens from mother to a pregnant woman to her baby. They don't know if it can be transmitted through even breast milk yet. So their inclination is to remove the baby. Now, the CDC is also saying, hey, if you're breastfeeding, we want you to keep breastfeeding, because breast milk is what we see, or what science says is best for baby. Keep breastfeeding your baby, but make sure there's no coughing, no sneezing, no droplets of anything in the air, so on and so forth. So if you need to, cover your mouth with a blanket or a towel or whatever to prevent any moisture from getting in the air. If you think you have the virus and you're getting a new one, a new little one, you want to make sure that you do everything that you can to protect that baby from the transmission. But they really don't know yet. They're not clear on how it does transmit from mother to a newborn baby, or if it can, or even if it does transmit. They don't know. So, and this is on the CDC's website. I actually went on the CDC's website to do a little bit of research to hear what they're saying about this pandemic for women who are pregnant, just delivered, or who are breastfeeding. So if you want to do a little research yourself, feel free to go on the website. We also want you to remember, though, we shared some very valuable questions earlier on about medical professionals being tested for this virus, and about asking if they have what are they doing exposed to this virus, working in a hospital environment. What are they doing to prevent the transmission from doctor to patient, whether that's you or your newborn? And so we also want to talk about some of the implications for separating a mother and the newborn in the first minutes, hours, or days after delivery. So we can be completely transparent here. We're all living in America, where we're witnessing the separation of families with the immigration laws and acts and ICE and all of this. And we see a lot of immigrants, and I don't even like to call them immigrants. We see a lot of people who have not been born in America, in particular those who are born in Mexico, Central America, South America, who are being separated from their families, children alike. And there's a lot of research out there currently on the impacts of separating children from their mothers and from their loved ones. And this research, it is so disheartening because it has such long-term impact on these children. And it's going to be hard to heal. There's a saying, I can't remember, is it Frederick Douglass that said this? It's easier to not break a child than to heal a broken adult. So it's better that we protect our children than to try to repair them once they become adults. So some of the implications that we can witness right away with a newborn being separated from their mother is the impact it'll have on breast milk production. Because if a mother is separated from their child, sometimes what they will experience is fear, panic-like episodes, insomnia, poor eating, poor self-care, and those things all contribute to a lack of milk production, or you won't be able to make enough milk because it's putting stressors on the body and it's blocking the communication to the brain. So we want, it's really clear if you have plans on breastfeeding that is taken into consideration. And then some of the implications it can have on your newborn is babies can deal with poor latch to the breast once you're able to finally introduce the breast to them. There can be a breastfeeding aversion, nipple confusion, crying due to stress, etc. And then we also know at birth, the human being brain is the most underdeveloped organ in the body. And so it actually doesn't fully develop until we reach our mid-20s. And so if a child is separated from its family long-term or unexpectedly, this child may experience the inability to properly process their emotions, and it could leave lifelong scars. And we want to do everything that we can to really work now on building the world that we want to see in the future. And that starts with how we take care for the children that are being born. Now, let us be clear. In the event that you deem it's necessary for your baby to be separated while you're in the hospital, you will want to advocate for your newborn to ensure that they are receiving the care that they need. Also, you want to make sure that the staff is clear on what your wishes are for your baby in the early days of your newborn's life. And you can ask questions based off of what you've decided will be best for your newborn. Some of the questions that you can ask if you have to be separated from your baby is, can I pump milk for my baby using the hospital grade pump? Or how much will I need to pump daily in order to keep up with my newborn's needs, etc. If the baby is going to be separated from you because you're showing signs or symptoms of coronavirus, or you have tested positive, and they wished your baby off after birth and you've had no contact with the baby, what happens if the baby tests positive for the virus after having been separated from you? This goes back to what are the hospital's current policies and procedures to make sure that it's not the medical staff that is transmitting the virus from doctor to patient. Because if there's a possibility that can happen, why not just keep your baby with you? Another question is, how long will my baby need to be separated from me? Will my baby need to stay in the hospital once I've been cleared to go home? And another one, if you're concerned about your baby having the opportunity to bond with those that love them upon their arrival, can my partner see the baby? My partner isn't positive, my partner isn't showing signs. You know, can my partner go and see my baby? Can my partner do skin to skin? Because we all understand exactly how important it is to for the baby to have adequate bonding in the first minutes, hours, and days of their life. And lastly, this is a no judgment zone. This is a judgment-free zone. If you decide that separation from your baby is what's best, we support that. Mama's intuition and intelligence are still keys to self-advocating for her and her newborn. That was a lot. So if you all have any questions regarding, trusting your intelligence, trusting your intuition, and then developing your newborn plan, feel free to drop those questions in the comments and we'll do our best to answer them. We're past the 1 hour mark, and thank you all to those who are still with us. We really, 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 truly appreciate you. And we just have a little ways to go, and then we'll be done.
So are you guys still with us? Just give us a smiley face, a yes, a no, something. Yeah, thank you again for being here, but we really wanted to make sure that it was worth your time. And so we thought that this was important to share. Okay, good, they're still with us, great. Okay, so here we're gonna talk about some ways to feel safe, because at the end of the day, we all wanna feel safe and secure and protected. And so this goes back to, again, just preparing your mind and your heart. So really affirming to yourself that you are powerful, you are capable, and you can do this. Whatever the journey ahead looks like, you are very able to face that journey and do it with grace and dignity and everything, okay? And this is not to say that you may not have anxiety or emotions surrounding it. Of course, you might, but even through all of that, like you've already said to yourself, look, I got this. I got this. Yes, I'm a little anxious. Things are uncertain, and that's okay. Through all of that, I know I will be fine. The other thing is you can have your partner by your side. So having your partner by your side can be really helpful, because in all the things that are unstable and uncertain, you have someone that is stable and that is consistent, right? So you've built this relationship, whether it's your partner, your husband, your boyfriend, the child's father, your mother, your sister, your doula, whomever that person is, that's the stability. That can be the rock amidst the chaos and amidst the uncertainty. And so just having someone there, even if they're not saying anything, like just being there can really, really, really help keep you grounded and feeling. Say, me find the answer, or help me uncover or develop whatever philosophies and things that I'm trying to figure out. So sometimes it's like the informational, emotional support that you need, and that's a doula can provide that, and a doula can provide that whether they're physically attending your birth or not. Because even in the way Zetson Affair and I work, the bulk of what we do is like prenatally, that's like the most important time, is helping to really helping the mom, the partners, the couples to really get to a place where they can feel comfortable and confident. And us being at the birth is, in addition, that's a plus, but really you already have developed all the faculties and capabilities to make decisions for yourself and to, be comfortable and confident. So hiring a doula, whether they're there or not, can be something that's beneficial. Also preparing your virtual support team. So in the event that your partner cannot be there or your doula cannot be there, having that virtual support, again, that's a level of consistency, that someone on speed dial, and just knowing that someone is there and ready and waiting to serve you and help you and support you can help you feel safe and secure. Another thing is to increase your oxytocin and endorphins. So
Uh-oh, I think we may have lost Kemita. Can you all hear her?
Uh-oh.
There she goes.
Okay.
You froze.
Oh, on what part did I freeze on?
Increasing your oxytocin and
Gotcha. Okay. So yeah, increasing these hormones can assist you with feeling safe and feeling good, right? Normally when we feel good, there's a level of relaxation, and we're just a little more grounded. And so some ways that you can increase your oxytocin and your endorphins is laughing, right? So if you have a funny partner, or if you want to watch something funny, laughter is a really good way to stimulate the release of your endorphins. Dancing is a good way to stimulate the release of oxytocin. Touching someone that you love, someone that you're close to, hugging. So if your partner is there, sharing some time together, which can also be really useful and helpful for the progression of your labor. And then lastly, you can request a patient advocate. So remember earlier, if you already got their contact information, you already found out how to request a patient advocate should something happen and you need to request them. And so that's another option. And even if they're not able to come in the moment, they can still help you to seek resolve to whatever matters may have occurred during your birthing time. Did we have any questions that came up or anything, or we should just keep going? We're almost done, y'all, I promise. Keep going. Okay, so lastly is finding the right support team. Your support team can make or break your birthing experience. And this is not just your external support team that I'm talking about as far as who your provider is, what nurse you get, et cetera. This is also choosing the right support team from the people that are very close to you. Some people may really benefit from having her there. Their partner is it's someone that can support them in that time. Some people may have a parting there, or there's agreements that have been made that it's best for them not to be there, and that's okay too. So you really just want to find the best group of people. And even, let me say this too, some people want to give birth alone, and that's totally fine too, okay? So these are generalizations, but really it's your choice, and we support you, whatever that is. So if you are looking for a midwife, here are some resources. There's systemmidwife.com, especially if you're looking for a midwife of color. There's also midwife.org, where you can search for midwives in your area, and it'll break down whether they work in a hospital, birthing center, if they're a home birth midwife, et cetera. So you can really explore your options. To stay up to date regarding pregnancy and COVID-19 developments, a really great website is evidencebasedbirth.com. They really put a lot of work into understanding the evidence behind typical hospital policies and procedures. So Zetanafert was saying earlier, there are some things that are just defaulted to as the standard that have been proven unuseful or detrimental. And evidence-based birth really takes the time to dig in and explore each and everything. I mean, everything we talked about in this slide, you can pretty much find some further information on evidence-based birth. Also, there is World Health Organization, the Center for Disease Control, as well as ACOG, where you can keep up to date on how things are developing surrounding pregnancy and COVID-19. And then,
just a side note, ACOG has a lot of outdated information on it, and some obstetricians are still using information on ACOG from 20 years ago. So you want to, tread lightly on some of those articles. Make sure you check the date, and make sure your doctor is up to date on what the science and what the research is currently saying about pregnancy and child.
Thank you for that. Really, evidence-based birth, that's going to be my way to go. The top suggestion. It's very thorough, so check it out. A lot of great free information. And then there are, oh, that's you? Maybe it's, okay, sorry. Then there are mommy support groups that you can join. So even though we're in a time where social distancing is necessary, you don't have to be alone. And so virtually you can join mommy support groups. And there's Black Mamas Matter, there's a Black Moms blog, as well as Poisera, which is actually a moms group specifically created in response to COVID-19. So definitely want to check those things out. And then lastly, if you are in need of doula support, Zetanafert and Our Mother's Light, are more than happy to talk with you and just figure out what your needs are, what you're looking for, and how we may be able to serve you during this time in reaching your birthing goals. So whether that's just information that you need, or whether it's a little more in-depth support, and even if you're local and planning a home birth, or birthing at a facility that is still allowing doulas to be present, those are conversations that we can still offer as well.
Uh-oh, guys. I think we may have. Do you guys hear Kimita? Drop a 1 if you can hear. Drop a 2 if you can't. Okay, it looks like she cut out. So she was just saying that both she and I are currently offering, Our Mother's Light is offering virtual doula services. And so you can feel free to go to our website and take a look at our virtual offerings. And you can also feel free to schedule a consultation via our calendar on the website. we'd be more than happy. And even if you just want to email us or give us a call, because our number and everything, our email, everything is listed on the site, we'd be more than happy to talk with you, to email with you, to text with you, to answer any questions that you may have regarding birthing under the current climate. Okay, hopefully she comes back really soon, because we're getting to one of the most important parts of a webinar, and that is questions. Welcome back, Kavita. Uh-oh, looks like she froze again. So if you all have any questions, I think we've been answering questions as we kind of went. Okay. So if you all have any questions, please feel free to drop any questions in the comment box. And Kimit, if there's anything else that you wanted to say regarding our virtual doula services, please go ahead and share. And if you're in Chicago, we are still offering face-to-face, you know, support at a distance, though. Okay, we have a question here from.
Okay.
Go ahead. We have a question here from Sonal. I hope I'm pronouncing your name right. She said, I had an emergency C-section during my first birth, and I was planning on going for a VBAC as I was going to have family support. With COVID, I might not have family support during and after birth. Do you think I should consider a planned C-section? I'm due first week of August. Okay, well, you have some time to go, Sonal. So it looks like you said the first week of August. So we're in March. We have 5 months. So hopefully they're predicting that the pandemic will begin to calm around, if we can really get people to adhere to social distancing, you know, it should start to calm around May, you know, in the months where it starts to get warm outside, and it should kind of quell things. So hopefully by the time August comes, you will be able to birth vaginally if that was something that you wanted to do or you had planned to do for this pregnancy. But again, we always say ask your provider as well. We want you to have those questions or those conversations with your provider, because we want your provider to be clear on what your wishes are. Now, not as you get closer to your birthing time, but now ask them, say, hey, what do you all, what is the plan if this pandemic is still raging by the time it's time for me to give birth? Will I have to have a C-section? You know, and that's not what I wanted. I wanted a VBAC, you know, or I want the C-section, but I need someone there with me. I don't want to wake up after being under anesthesia and don't see anybody who I'm familiar with, not see my loved one, you know. So these are things that you can, you know, you can ask your provider. Camilla, please. It looks like Kimita is frozen again. I just don't know what keeps happening on her side. If you all have any more questions, please feel free to drop them in the comments. We are here. We are available. We've been going for almost 2 hours now. We had only planned for an hour, but it was so important to make sure that we delivered everything that we had planned for you guys. There you go. Welcome back.
Oh, okay. Did you guys hear what I was responding to Sanal? Did y'all hear me?
No.
Okay, I wanted to add one thing to her, because you had mentioned that you were planning to have Okay, can you hear
You
me
there,
now?
Camilla?
Yeah,
There
I'm
you
sorry,
go.
guys. Did you guys get my response?
Okay, guys, let's keep going. Let's keep moving forward. Unfortunately, it looks like is experiencing some challenges on her end. So if you all have any more questions, and so now, just drop us your email in the chat, and I'll make sure you can send it to me privately too. There's a way to privately message us on here. So I think Camilla is gonna type her response to you, Sonal. Sonal, is that Ymail or Gmail? While Camilla is typing her response to Sonal, if you all can just jump in the comments and tell us where you all are joining us from, that would be really, really great. So Camilla is saying, she said, keep in mind that recovery for a C-section is much more difficult than a vaginal delivery. So if your family won't be around a vaginal birth may really work in your favor. So we have Isis from Urbana, Selena in Chicago. Hey, girl.
Hey.
Someone whose name is showing up as WTM43 is in Jacksonville, Florida.
Hey.
We have Sharita. Hey, hey, sis. We have someone from Broward County, Florida,
awesome.
Pittsburgh, Pennsylvania.
Awesome.
Wow, that is amazing. Thank you all so much for joining little old us.
Thank you so much. Yes.
So much.
Yes.
It is so humbling. I'm telling you, it is such a humbling experience. We really, really, really appreciate it. We're gonna go ahead and take a couple more questions if you all have any. And if not, we are going to say goodbye. So, just drop your questions if you have any. Can you tell us where doulas can get more support? I have more questions about how to best support my clients.
Yeah.
I would say the first go-to would be to call your certifying body, your certifying organization, and ask them, what are you all doing to make sure that we are getting current and up-to-date information on how to support our clients under this pandemic? Because in fact, we are putting ourselves at risk too, right?
Yeah.
To be with birthing people and their families during COVID, while the country grapples with COVID-19. So my first step is to go to my certifying body and ask them. And if the certifying body doesn't have the information that you need, you can talk to midwives in your area. Isis, for us who are here in Chicago, it would be really good, if you could reach out to Janine. She is a wonderful, wonderful resource, and she can keep you updated and informed. And she's saying, I still haven't seen anywhere if I can even touch my clients, use gloves. Yeah. There's current research out saying using gloves puts you more at risk. Yeah. And I'm not really sure what the science behind that is, but they're saying using gloves puts you more at risk to contracting the virus. Wearing a mask puts you more at risk of contracting the virus. And so it's going to be really important to look into that research that is coming out every day, because again, it's changing every day. Something new is popping up because they're doing more research, they're studying more, and they're figuring out what this disease really is and how to protect the public from it. And Keita is asking, what can you take to build better immunity for breastfed babies? You know, that's our specialty right there.
We actually did a, so follow us on Facebook. Let me say that. You can find us on Facebook at Our Mother's Light. The apostrophe comes after the S, as it, look at the logo. And we do a live video every Thursday there. And just a couple weeks back, we did a video on building your newborn's immunity. And we laid out several different options that can help build your newborn's immunity. Breastfeeding was definitely one of them. And of course, you know, upping your own nutrients and stuff, but there are so many other things as well that we covered that are directly done to baby to help build them. So as long as you continue to fortify yourself, you know, with good foods, and we also gave out a link to a super tonic that you can drink to fortify your body. And, you know, of course, as you're feeding your baby, baby gets the benefits of all of that. In fact, hold on one second, I'm about to show you.
Keita, you're saying that the baby is 8 months old. No, the baby is not too old to be breastfed. The baby is not too young for you to make sure that you're building the baby's immunity. One of the things, she's going to show you the super tonic, and then I'm going to tell you something else you can do, Keita.
So I wanted to show you guys this, and I'm glad you asked, because there's another webinar happening tomorrow to show you how to make this. So we'll include that in the recap video. But this is all natural: onions, garlic, cola nut, what else? Lime.
Bitter cola.
Yeah.
Bitter cola, garlic.
Yes.
And a bitter red wine, so like a Cabernet Sauvignon. And if you can stomach Merlot, you can use Merlot.
And even, let me say this too, because I know the question was regarding a breastfeeding baby. And I want to just say, as we said in the beginning, our model of care is based on our, largely based on our African healing traditions and postpartum care traditions. And so I get it, like you hear the word wine, breastfeeding, you know, that might stop some people in their tracks. But really, this wisdom is very, 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 very old and very reliable. And this is something that is okay to take. You only take a shot glass worth. And it's okay to have this while you're still breastfeeding. And it's a super tonic. And like I said, we'll link to the live DIY video workshop happening tomorrow so that you can make this yourself.
And one of the other things that you can use to build the baby's immunity, if she's taking food, you can actually make what is known as it's millet porridge in English. You can get it from you can get millet flour from an African market, an Indian market. Pete's Produce up here in the Chicagoland area carries millet. You'll usually find it in Mariano's. You'll usually find it in the ethnic food aisles because it's a very common flour used in cultures around the world. And so what you'll do is you will mix the millet in a bowl, a cup of millet flour to a cup of water. Not hot water, because you don't want to start cooking the flour, but you'll mix the millet. And do we have this on the website? I don't think so, but I think we may have discussed it. I think we may have discussed it in one of our lives. So you'll mix it in a bowl before you put it into the pot, because you want to make sure that you don't get any lumps. And so after you've mixed it in a bowl, a cup of flour with a cup of water in a bowl, you'll add it to your pot. And as it thickens, you'll add more water to it to loosen it up. And you'll cook it until you've cooked the flour very, very well. And it's nutritionally dense.
Yeah. It
is a really good flour. Even if you're breastfeeding and you're having struggles with producing breast milk, this will boost your breast milk quickly.
Right away.
Very, very quick.
Yes.
Right away. And so you'll make it into a porridge, and you'll get the consistency that the baby needs at 8 months. And then you'll add in what we call potassium. You can get that at an African market. Just ask anybody who's working in there where it is. And it's a rock. It's a mineral that comes from the earth, and you're gonna take it and you're going to get a mortar and a pestle. You're gonna crack just a little piece of it off, and then you're just gonna grind it up in your mortar and your pestle, really to a really fine powder, and then you're gonna add it to your millet porridge, and then you're gonna sweeten your millet porridge. Again, we're coming from the traditional African, West African perspective. They use honey. We know in this culture they say don't use honey, but in that culture they use honey. And they use really good honey. And so we always recommend that if you're going to use honey, against the recommendation of a baby, with giving it to a baby under a year, that you go to a farmer's market and get for honey, or you get it from a whole food, health food store, where you know that the honey is actually honey and not syrup, you know, some type of a syrup. So and you add a little bit of honey or any other type of sweetener that you feel comfortable using, agave. If you feel comfortable with using sugar, we really encourage limiting sugar consumption in babies, because they will develop hemorrhoids, and that is not comfortable and it does not feel good. And then you'll just feed the baby the millet porridge, and that will help to fortify the baby, and it'll help to build the baby's immunity. And Keita, you know, you can always call me, or text me or message me or whatever. And that's for all of you. Our number is on our website. Our email is on the website. So if you have any of these type questions, you can always feel free to message us. And can you upload on your Instagram the recipe? Yeah, I don't know if you downloaded our postpartum guide from our website, but it was actually on our website for a little bit. So we're gonna actually put that back up sooner than later. But I'll text you. Oh, you guys have it?
What'd you say?
You all don't have any more questions.
Okay, I'm looking at my phone to see too.
We are coming up
at 2 hours.
2 hours. And
you guys.
And y'all have been hanging tough with us. We've had quite a few people drop off, but for those people who are still hanging tough with us, thank y'all so much for rocking with us. We truly appreciate y'all.
Yes. Yes.
So if there are no more questions or concerns, you have our contact information, and just be on the lookout for the webinar's recap.
Yes, thank you guys so much. Thank you. Bye.
Now, how do I end this? Okay, let's see. I pressed end. Did it end?